Okay, ma'am. The first question is from Dr. Rita Malik. She wants to ask, should we test both the partners for viral markers in the first antenatal visit of the patient?
Okay, this is from the last topic. So definitely, basically, because if a woman is HIV positive, then if you are testing the women, if women is positive, that is definitely the partner should be tested for the positive. In case the women is negative, so there are the many cases where the partner is positive. We need to take the history. Although it is not a mandatory thing, I mean, you cannot force the partner to be tested if the woman is negative.
Okay.
If woman is positive, you have to ask the partner to be tested. But if the woman is negative and you want to take, you should take the history. If you feel that this patient came from the area where, I mean, you need to be
right.
Enough.
Fine.
Judge.
Fine. Yes, we've got it that it is not mandatory. But if we feel that it is, we are suspecting something, yes. Dr. Sharda Jain, ma'am, please.
Dr. Divya, what is our policy is that, in a lady, we are getting all 4 markers done. But as a gentleman, whether I'm not getting hepatitis B, C, and this thing, but I definitely get HIV done for these patients, because I feel this is the opportunity where I can say that, look, you may be, your wife may be in the window period. If you're positive, we will come to know about it.
Thank you so much, ma'am.
And that is the reason I always wish to tell you that, initially, if the HIV is negative, at the time of late in pregnancy when she's delivering, this is the reason that they want to get the test done again. Because if the person has been in a window period, she will be negative. But by the time she delivers, the test is done.
I think this is very important for all of us, this take-home message that we must repeat the viral markers just before her pregnancy, before the expected due date in the last trimester. The next question.
Two of the patients who were just showing me the report of the first trimester negative, and they came out to be positive in the labor. And there was
Absolutely.
a drama in the labor room.
Absolutely well taken, ma'am. Dr. Ruby, the next question is very rapid fire questions. What is the number of HIV infected cases in India so that we have an idea?
This is 21 lakh to 23 lakh we are having currently in India.
Is the rate falling or is it increasing?
The rate is definitely falling as such the number is concerned. Basically because death rate is falling because of the ART. Transmission rate is again falling due to the people who are taking the antiretroviral treatment. So अगर viral load suppress है तो transmission rate उतना ही कम हो जाता है. So definitely numbers are falling, but the new cases are still there.
Thank you, Dr. Ruby and friends. This is again a good message that things are looking up for HIV. We must use the antiretroviral therapy. In case we have a problem, Dr. Ruby is available 24/7. We must send the patients to people like her. So the next question is, what is the one diagnostic test for HIV, Dr. Ruby? I mean, we should know.
Diagnostic. One diagnostic, if you are in the labor doing, you can do the rapid test. So rapid test is like your pregnancy test kit. So it can tell you the result within half an hour. Yes, right. So this is the one test. But as a matter of the policy, as a matter of the guidelines, we need to do the 3 tests, either with the 3 different antigen kits or with 3 different methods. So
yes.
On the one result, one test positive, you cannot label that patient as HIV positive.
Yeah, but in a emergency, when the patient is laboring, this one test should be enough, isn't it?
Yeah.
So the next question is, what is the drug given to a woman who is diagnosed with HIV first time during labor, so as to prevent vertical transmission to the neonate during labor? Now we have a patient who has come first time to us during labor, and we have done an HIV on her and she's tested positive. So what do we do next in order to prevent a vertical transmission to her neonate?
Earlier there was a big role of zidovudine, and zidovudine is supposed to be the best medicine. There is no doubt about it, especially in the early transmission. So earlier what was given, if the patient came during the pregnancy, during the labor, so either the zidovudine or the nevirapine. Nevirapine were given 1 dose to the mother and 1 dose to the infant. But as I told, nevirapine shown lot many resistance. So nowadays, if the patient coming to the labor, if the patient coming in the early pregnancy, only this three-drug combination, tenofovir, lamivudine, efavirenz, or tenofovir, lamivudine, lopinavir, ritonavir should be given. That's the one thing.
You mean
It works best.
All right. So once we've tested her positive for HIV during labor, we give her 3 drugs and not 1 drug. Right?
Yes.
Okay. So do you allow an HIV mother to breastfeed her baby, and for how long?
Again, Dr. Jyoti beautifully explained this, what should be the procedure. If we need to talk, this choice should be the patient's choice, because all kind of the patients are coming. Few, maybe is the poor category, they cannot follow they cannot afford the formula.
Yes.
So we need to be very, very clear and explain it clearly. कि look, आपको अगर अपना दूध पिलाना है तो अपना दूध ही पिलाना है, उसके बाद ना घुट्टी पिलानी है, ना पानी पिलाना है, ना कोई बाबा की दवाई पिलानी है, ना कोई सासू माँ का कुछ काढ़ा पिलाना है, कुछ भी नहीं पिलाना है, सिर्फ माँ का दूध. हमारी इंडिया में प्रॉब्लम क्या है ना, माँ के दूध के साथ वो घुट्टी का बहुत बड़ा प्रॉब्लम है कि घुट्टी जरूर दो, इसके पेट में गैस हो रही है तो इसको ये चटा दो, इसको वो चटा दो. दैट इज द बिगेस्ट प्रॉब्लम इन अवर कंट्री. तो यू नीड टू बी वेरी वेरी क्लियर कि बच्चे को कुछ भी हो जाए, आपने अपना ही दूध पिलाना है, ऊपर से आपने कुछ नहीं पिलाना है. देन शी कैन ब्रेस्ट फीड to up to 6 months and sudden weaning, and then you can suddenly start the formula feed or other things.
Thank you, Dr. Ruby. That means no mixed breastfeeding, no mixed feeding, because that can lead to HIV in the transmission in the neonate. So we have to explain to the mother, to her attendants, why it is especially important for her not to mix feeds. So what are the precautions? What are the
I think it must be emphasized. If he's taking more than breastfeeding and other feeding, then the transmission becomes doubles. So you must tell her that in case if you're going to do this, it will double up the transmission. So you are either up upar wala pilao or ya phir apna hi pilao.
Ji, yes, ma'am. So what are the precautions or the steps taken for the newborn soon after birth to prevent infection in the baby? So आपने उसको delivery कर दिया, forceps नहीं लगाए, episiotomy नहीं लगाए, you have tried your best कि भाई उसको ठीक से safely deliver कर. Baby is in your arms, and what are you supposed to do?
We avoid the invasive procedure, especially the suction. We do avoid the suction, deep suctions in these babies. Okay, so these babies, if the neonatologist is taking, only is taking in the cloth or the top, whatever the cloth, wiping them up properly. So all the fluids, all the mother's fluid, जो भी उसकी body पर लगे हुए, वो सब अच्छे से clean हो जाए. So why? Because bachcha will carry. Bachcha is not having the her own transmission or her own HIV. He will carry. He will superficially or with the mucous membrane will absorb the mother's from the fluid of the mother. So उसको बहुत अच्छे से clean करके और जो है suction और जिससे इंजरी नहीं हो उस चीजों को avoid करे. एकदम से clamp cord को clamp करके suddenly cut करना होता है. So early clamping the cord and cutting the cord. So these are the things, and the giving the nevirapine syrup, 0.2 milligram per kg body weight to the child immediately within 2 hours of the birth.
So especially probably holds good, especially for those patients जो HIV positive mothers हैं and they have not been able to receive any antiretroviral therapy. So definitely the chances of vertical transmission are far more. So that is why we should give some prophylaxis to the baby, and which includes, could you please sum it up, what is the prophylactic ART for a newborn?
This is the syrup nevirapine, 0.2 milligram per kg body weight of the child, to be given once daily or in 2 divided doses.
Right.
Okay. Basically, because nevirapine again is a very, very dangerous drug. It creates lot of allergies, lot of rash. So we need to monitor it very, very carefully, because sometimes even the Stephen Johnson syndrome is very common with the nevirapine. So sometimes these child after the first dose even they will get easily very sick. So neonatologists should be knowing all these things And this dose should be given within 2 hours, and then further from the next day as per the 12 hours interval or the 24-hour interval. For
Yes.
Dr. Ruby, can I just add one line?
Yeah.
Yes, it should be given within 2 hours of delivery, but by chance, suppose it is not available or whatever, and somehow it has been missed, then they say even if the baby comes after 72 hours, then also you should start the prophylaxis for the baby.
Yes, ma'am. It is just said, but ideally, basically, because
the best results, yeah, definitely the results will not be that good, but earlier the better.
I just want to tell the gynecologist, because if you have diagnosed the mother, right? So definitely, this is the duty. You should arrange this nevirapine prophylaxis for the this mother. Ask them that you should be having ready. So basically, because these medicines are not available anywhere.
Yes,
In the
yes,
rush,
Dr.
you want-
Yes. Okay,
So we
our
should
next
arrange-
question. Sorry.
No,
Yes.
we should keep them arranged once we are delivering an HIV, so that there's no delay in giving it to the infant, to the baby, to the newborn.
Yes, thank you. So the next question is, sometimes while playing, children get accidentally injured from discarded needles found lying in public parks and such places. So suppose somebody brings such a child with a needle stick injury, what do we do? Discarded needles.
HIV वायरस है ना, वो क्या कहते हैं ना, बहुत ही फ्रेंडली सा वायरस है, बहुत डेंजरस जरूर है, बट इट इज ए वेरी वेरी फ्रेजाइल वायरस. It doesn't once it is dry, it doesn't survive. Okay, so basically because it survives in the body, in the blood, in the fluid only, in the humans. Otherwise, it cannot be transmitted. So if the needle is lying in the park, definitely the tetanus chances are there, or the other disease, other salmonella or other infection chances are there, but not HIV. So these children should not be worried for the HIV prophylaxis, or if they just got it injured with the, कई बार होता है, कई बार पेशेंट्स आते हैं कि हॉस्पिटल के पास की निडल था, उससे सुई लग गया है ना, तो हमारे पैर में, तो हॉस्पिटल के पास में हो सकता है HIV मरीज का हो, बट there are no chances of HIV with these.
Yes.
को कोई बहुत ज्यादा ही पैनिक है, so we give them 2 drug regimen.
Right. So, Dr. Ruby, from your excellent talk, it seems that after following the needle stick, ma'am, last question पूछ लूं? Following needle stick injury, the chances of getting HIV is very low. This is what we understand. But what about hepatitis B? You said it happens in the ratio of 1:3. So just highlight something about hepatitis B and we close down.
Yes, I already this about the hepatitis B. Hepatitis B का ट्रांसमिशन रेट सबसे ज्यादा है, पर सिर्फ एक यही जो बीमारी है जिसका वैक्सीन अवेलेबल है. तो आई ऑलवेज एम्फसाइज ऑन द वैक्सीन. All the professionals who think of, joining the healthcare industry, they should be vaccinated before. So all the students should be vaccinated once they are getting admission in the MBBS. Or nowadays it is a part of the national program. So now all the children are vaccinated for the hepatitis B. But the age 40 साल के 30 साल के अभी भी हम जैसे लोग या पुराने जैसे लोग हैं, उन लोगों को हेपेटाइटिस बी वैक्सीन नहीं लगा हुआ. तो जिनको नहीं लगा हुआ है वो अपना वैक्सीन लगवाएं, अपने टाइटर्स चेक करें, और दैट्स द बेस्ट थिंग.
What about the booster hepatitis B you were talking about, Dr. Ruby?
Booster, I told in my presentation also कि अगर जो है एंटीबॉडी टाइटर अच्छे हैं तो देयर इज नो नीड ऑफ द बूस्टर. अगर एंटीबॉडीज नहीं है तभी बूस्टर या रीवैक्सीनेशन की जरूरत पड़ती है.
ठीक है, thank you so much, Dr. Ruby. And anybody who has any problem can, of course, contact you directly.
Dr. Divya, I think what Dr. Ruby has said, that particular message has to be taken. Government, private colleges insist that, before the child gets vaccination must be taken. But in the government medical colleges, it is not mandatory. So it is not followed up. So you find many of the doctors, nurses miss it out on this particular thing. So I think it's mandatory that as a clinic in charge, you must see to it that all the staff available with you is immunized against hepatitis B. This must be done. It is punishable in case if you're not doing it.
Yes, ma'am.
Yes, perfectly.
Point well taken. Absolutely. Dr. Sharda Jain, ma'am, would you like to end up by giving us a one-liner on HIV? Anything, any other message?
I think in CME as well as dedicated to, and I feel, our aim was not much. Last time we found that, almost 100 people had joined, but this particular time, I was still had watching it, like 80 people this particular. Our idea is at least 80 people, 100 people are sensitized. So at least they know about it. I think, once this particular thing keeps going, so at least एक बात बिल्कुल क्लियर है, हमें जब भी आपका HIV का पेशेंट है, हमने रेफर नहीं करना, हमने ग्रैंड ओपनिंग करानी है, HIV एक्सपर्ट के साथ उनकी ओपनिंग करानी है, ये डॉक्टर साहब आपको करेंगे, आपने दवाई लेनी है और इनको भी इंसिस्ट करना कि आपने दवाई लेनी है. So the total care is between two of you. Alone you cannot manage. It will be great, and we will see each other on after a month. That will be a good.
Thank you, ma'am, and maybe next time we'll have some dances also.
Congratulations,
and Dr.Archana Pathak. Dr.Archana, wind up. Thank you, ma'am, so much.
Thank you, Sharda ma'am. Thank you for your excellent inputs. Thank you, Dr. Ruby. You gave us an excellent insight into post-exposure prophylaxis and needle stick injuries. And thank you, Dr. Divya, for a very excellent moderation. Thank you very much.
Great. Thank you. Thank you very much.
Thanks. Bye-bye. Goodbye. Thank you for joining us.
Thank you. Thank you very much.
Thank you, ma'am, for giving us the opportunity.